If I am at all distracted, it's because I'm trying to admit people whilst talking to you, whilst watching what people do, whilst looking at the chat box. So if I come across like I'm really distracted, it's because I'm multitasking. Um,
Okay.
so this is a recording, guys. I hope you all don't mind, but what we will be doing after this event is using the recording within the member zone so that everybody can see it on Facebook. But we're also going to be dicing and splicing and bringing out some really powerful content that we can then use elsewhere within the CAM world. Because this lady, I seriously feel like I have been waiting for a year to speak to you about what I saw at Wasava. So I'm going to crack straight on. This amazing lady stood up on stage in what's called one of the pain management streams at this World Congress. And you might have the oncology stream, you might have, let me start admitting people, you might have surgery stream, etc. But we had a stream dedicated to pain management. There was probably about 400 people in the room. And up until this lady took the stage, it'd been quite dry, it'd been quite scientific. And your PowerPoint was really on trend as well, in that very few words, statement pictures, and you had your characters, your animals coming out the screen towards people because they were so bold. So everybody was just leaning in to hear what you were saying. And then you just took a complete detour on pain management. You know, you completely was like, yeah, I know, I'm doing it my way. So, guys, I think you're going to be blown away by what this lady tells you. Please introduce yourself, Katia. Tell us a little bit about your bio, how you got to where you are, and then tell us what you're up to. And then I'm going to fire some questions at you.
Okay, Hannah, thank you very much for your presentation. Hello, everybody. It's a really pleasure to be here. Actually, 1 year since we
One,
met, and we were just saying, "Oh my God, just 1 year is just just flying so fast." And well, what can I tell about me? And well, that experience that you were talking about, it's so good to have this feedback because, well, just to start, I'm a vet. Over the last 17 years, I've been working on canine and feline rehabilitation and pain management. I remember when I started here in Portugal, in Oporto, where I'm living. I was, first of all, I was working as a commercial in Royal Canin, so a brand, an international company, and I was not happy. I felt that I was missing something in my life because I always dreamed as being a vet. And over the last 3 years, I decided to go to a completely different way of work as a vet. But then I was missing this clinical contact. So I returned to clinical practice. So over the last 70 years, I've been doing that, just studying and working on and small animal rehabilitation and pain. And and life is, well, when you are the first or one of the first of your country trying to bring awareness about the importance of doing pain management properly, not just intrasurgical, but how to take care of patients before surgery, during and after surgery, and many other conditions. So I started to be invited to collaborate with some companies like Improve International. I don't know if we have vets here, but it's a worldwide international company that promotes education for veterinary nurse and technicians around the world. So this amazing area has opened me a huge opportunity to reach other people, to bring this awareness and this feeling that you were saying, Anna, about the presentation on the SAVA Congress. Actually, for me, was a huge honor to be in front of a lot of colleagues and nurses and people say, people, we can manage that in the different way. We can just change
yeah,
our perspective in the way how we see our patients with pain. So let's try to see it, as you were saying, it's very important to have this scientific basis. And I always study a lot to have these foundations of my work. But there are some things that you don't see in books. So maybe it's time to start writing that, to start bringing this awareness to our world when we deal with small animal pain.
So when
So
you said that you started off like Royal Canin,
yeah,
did you come straight out of university and go straight into
no.
industry? No.
Actually, I worked for 3 years as a vet doing practice. Although I was working for other colleagues, I was by my own.
Oh
So
wow.
I stressed a lot, as many of our colleagues, when they start working, you have such insecurities. When your patient dies, if you think that it was your guilty, you always try to figure out what could you do differently.
Mm,
So I I was dealing this feeling that to be a vet like that, I prefer to go out.
yeah.
So I had this opportunity to work as a commercial, and I used to say that it was my opportunity to reconciliate with my profession,
Yeah, yeah.
because during that time, during 3 years, I was able to recover my mental health
Yeah.
and to feel the need to become again a practitioner
Yeah,
in
yeah.
clinical.
So I don't know a huge amount about the state of the vet industry in Portugal, but from what I've seen, it's can be quite isolated. I don't think it's very well supported. It's very poorly paid. It's very poorly
Yeah,
paid.
yeah,
Um, the career progression can be quite minimal. A
yeah,
lot of the practices are still quite country and isolated, so they don't have the backup of referral centres, like a nice little network. So, yeah, I can imagine as a new grad, it would have been blinking horrible.
yeah, yeah. I felt that I was not learning, and I was getting afraid of doing things. When
Yeah.
you instead of evolve in your practice, you are going back. So I said no, but no, I want to stop that. So when I decided to come back, canine rehabilitation and small animal rehabilitation and pain was the unique area where I said that's the place where I want to stay.
Yeah.
So
Do you now, knowing what you know now, look back at those 3 years and go, oh,
yeah,
it's horrendous, isn't it? Like in my first job, just thinking about the dentals that we did and
yeah.
how there was the lack of local blocks and analgesia, and I just feel horrendous.
Oh God, yeah, I know what you're saying. Yeah, I remember some things that we did in our internship, when you were castrating a cat and someone was saying, please hold his head, almost finishing, and now you look back and say anesthesia at that time. I finished my career, my school 22 years ago. No, 23 years ago. So it
Same
was
as
a lot.
me.
Oh, really? Good, amazing. But it was like if it was in another century, it actually
Yeah.
was, but you know what I mean.
Yeah.
So such a difference that we have today
Yeah.
concerning analgesia.
And I don't think people realize that the progression that we've made in the last 3 decades is
Mm-hmm.
insane. In
Yeah.
that, I was looking into the history of veterinary analgesia, um, veterinary pain relief, and we've only had non-steroidals since the
Mm-hmm.
1990s.
Yeah.
That's crazy, isn't it?
That's true. Yeah.
Yeah. So, okay. So what we wanted to do is I want to take everyone that's listening, following us today on a bit of a journey of your interest into pain management and when your penny dropped of I'm gonna do it my way because that makes more sense to me because that's a very brave thing to do. And what I'm gonna do is I'm gonna give them a little tantalizer of what I mean by her way by describing a couple of the videos that I saw during the presentation. Now, you quite often have your rehab pain management patients come in as day patients. They stay for the morning, they stay for the day. And she put up this amazing video of tea break time. And that's where the day patients all come out and everybody has a chill out time. So there's all different, dogs with different ailments socializing, engaging, having a little bit of an experience, all safe, all super safe, you know, non-slip floors, lots and lots of staff there engaged, making sure that everybody is emotionally and physically comfortable. But the fact that you were like, well, when they come to me, I'm not going to just treat them physically, I'm going to treat them emotionally, because that's a powerful pain relief. And I just was like, so tell me how and when and where you found the confidence, what happened?
Well, let me see, how can I start it? I think that everything starts with empathy. You know, when you empathize a patient, you can see through his eyes. So one of the things that I've learned, I'm that kind of person. I don't deal very well with pain. Okay, so I'm very sensitive to pain since I was a kid. And I realized that in my life, when I was paying attention to other things, my pain go out, you know, just like if my brain is not paying attention to my pain. So it's like if I don't have, it looks like I took a pain relief without having a medicine, you know.
Mm.
So when we manage pain with our patients or human beings, everything we do is to compete with our brain perception of this noxious stimulus. So that means that you can compete depending on what you want to play. You can use drugs, of course, you have to many times, but we cannot forget that the emotional part. And now let's empathize with our osteoarthritis patients or our neurological patients or any kind of patient that it is in an hospital or in a clinic, hospitalized inside a cage. So let's bring everyone to a cage. So imagine you are a patient, you went through a surgery. Now they put you in a box. You are away from your owners. You are in a place that you have never seen. You are seeing lights. You are seeing dogs barking that are asking for help, and you don't know what's going to happen. Then someone comes, open the cage, brings you, I don't know, just put a thermometer in your anus, wherever, do something that you really get scared. So then you start thinking, I'm going to die, something very, very bad. You become to be very catastrophic about what's going to happen next. Okay. So if you went through a surgical procedure, or if you have any painful condition, and many beds in the hospitals are not good beds, you know, it's like just a towel, and we're lucky, we know,
Yeah.
no, nothing very soft. So when I put myself in that position, and I think, if I was a dog, how would I feel when in this situation, away from my family, in a place that I don't know these people, when I hear other dogs barking all the time, and with all that, I also have my own condition that is causing me suffering and pain. Okay.
Yeah.
So everything that you want is someone to give you attention. And we
Yeah.
know that in hospitals, there's no time. They have to save lives. Every time you have an intern, a student, paying attention to an animal, someone will say, don't do that, go to your work and leave the animal there.
Yeah.
It's the reality. So
Yeah.
lucky my practice, it's my own practice. And I always wanted to do things by myself, the way I wanted. So I decided to have my own clinic. So there I defined the rules. And one of the rules is, we have to look to our patients, take care of them if they were yours. Take care.
100%.
Yes, yes,
Yes. I say that to every nurse that I work with. I'm like, we're going to treat this dog or this cat like it's our dog or cat. That's the rule. As long as
yes,
you have that mantra, everything else falls into place, you know, as far as I'm
absolutely,
concerned. Love it.
absolutely.
Can I just read what your Instagram description is? I saw it this morning and it just blew me away. So, pain and rehabilitation vet, expanding awareness about animals' health and mental health in veterinary medicine. I'm gonna have to introduce you to my mate Sarah Heath. She's just gonna love you. So you did your rehabilitation training.
Yeah.
That how long ago would have that been?
I did my CCRP through University of Tennessee.
Yeah.
Although I did my certification in Europe, but it is an American association university that gives the certificate.
Yeah. And then did you boldly go and set up your own clinic pretty soon afterwards, or did you try bringing your ideas into practice where you were working?
Well, when I finished this CCRP, I really wanted to open my clinic in rehabilitation. My husband is a sports medicine doctor, and
Oh, well, that's
yes,
helpful.
yes. And he was at that time, he was already doing his practice on sports rehabilitation. And when I use this kind of practice, really, by the book, you have your certification, so you pick up the book, you do the protocol, and you put on practice, and it doesn't work the way
Yeah.
you were expecting to work. And I looked to my husband, he said, you have to look, forget the book, look to your patient, put your hands on the patient, do this, try to see him, try to see your patients, try to see what they are talking to you. And I was like, they don't talk. And he said, yes, but they don't need, because although he's a doctor, he really is like that kind of doctor, doesn't need, you give him an x-ray and he say, I don't want to see the x-ray, I want to see the patient, so forget the
Yeah.
x-ray. So I've learned that with him, and I say, okay, so we are lucky as a vets, because if dogs do not talk, you don't have this subjective perception. Okay, you have the subjective perception of the owner, but you have to create more awareness about your sense, your hands, your
Yeah.
visual. So because they do not talk, you have to do that by themselves. You have to do your best even more.
Yeah.
So very quickly, just to tell you, Anna,
Yeah.
just very quickly, I realized that just this techniques of canine small animal rehabilitation wasn't enough. So I did acupuncture, Western acupuncture course in UK.
Oh, did you
In,
do it with Sam Lindley?
yes, I
Nice.
did with her, yeah, and with Mike Cummings also. So I did a foundation course, and that changed my way of looking to my patients, because
Yes.
until then, I've never heard talk anybody about trigger points.
Yeah.
How is that possible?
But to talk about how it's just one of those fields where it's expanding and growing and morphing, and it's such a silly thing, but you're going to love
Mm-hmm.
this. I was with Beatrice Montero,
Mm-hmm.
who's a really big name in the pain scene, and we're over in China at the Chengdu Bear Rescue, and she in her lecture went, and she boldly went, happiness influences
Wow.
pain. And I hadn't heard any specialist simplify it down and down and down to that kind of bold statement, because there's a little bit of precariousness about being that bold. We know,
Yeah.
we know the
Yeah.
neuro system, that's how it works. You said distraction, different emotional states affect your pain. But it was the fact that she stood on stage in front of all of these key opinion leaders, these Chinese cynics, because they're quite behind our understanding. It's only just coming into their interest. So there's all these cynical people in the audience just went, happiness influences pain. And I was like, oh yeah,
Yes,
go
that's
for it.
good.
And I think we will see a dramatic shift in the way that we understand and manage pain. And I think that we will really quite rapidly progress into this more holistic approach. And what's really fascinating for us is that there's been a very holistic approach for decades in the non-vet sector. So
Mm-hmm.
over here in the UK, you have people doing their own thing. They might be vets or they're not vets. And they've been ahead of the game. They've been doing this sort of thing for decades. Then we brought in the evidence-based medicine approach, and obviously many of these things at that point didn't have substantial evidence to support them. Happiness influencing pain was not talked about. People would have been laughed out the room, wouldn't they? But now that we've got massive progression in pain neuroscience, we're beginning to get the science to back it. I think, unfortunately, in the last few decades, some people have run with the term holistic over here
Mm-hmm.
in the wrong direction. And I think
Absolutely.
it's made us really cynical about that term, holistic, treating the whole, treating the mind and the body. But then somebody else is selling fruit juice because it's holistic, they're selling another blinking digital tool off Amazon because it's holistic. So it took a bit of a nosedive. This is all my opinion. took a bit of a nosedive. But the vet sector seems to be coming up behind and picking it up in the right direction again. I'm really hoping that we're going to see like a proper unification of the paraprofessionals, the veterinary professionals having that universal understanding where, as you say, emotional health, cognitive distraction, physical and physiological influence are all important when it comes to pain management. It'd be amazing.
Absolutely, I
What's it
agree
like in
with you.
Portugal? Are people still thinking you're up to witchcraft?
Uh, it's we are in the beginnings, I think. I know that with the new drugs in the market, we have created a lot of awareness about pain. We
Yeah.
have never talked about osteoarthritis pain since the last 3-4 years. Okay, so I think that is a shift, and that's very good.
Mm.
But the problem is that people try to treat, for instance, we talk about osteoarthritis. People try, or vets mainly try to treat osteoarthritis pain just through an injection or just through medication. And they forget this holistic perspective, as you were saying, amazing. Because when they realize that it's not just a lame dog, it's a lame dog that lives miserable with his life because he doesn't have social interaction. Because one of the things that he most likes most is to play ball or to eat. And now the vet says, no play ball, no more food. So you take everything that this dog loves in their life. So you have to compensate with other stuff that could be increasing his happiness, as you were saying very well, once again, to compete with his pain.
Yeah. I love this because I feel like that having done I did the CCRP too. When did I do it? About 2019. Well, I don't know
Okay.
when
I
did you
did
do
it in
yours?
2006.
2006?
Yes.
Holy moly.
Yes. It was when my oldest daughter was born, so 17
Amazing.
years ago. Yeah.
So I was just trying to think when CAM started, which was about 2016, we had this pyramid concept. And it was the journey of the owner. So first of all, identifying the signs, getting a diagnosis if possible, managing your expectations, working with the vet because they're the only ones that can diagnose and prescribe. We need to have a vet involved. Pain is central to everything that we do. Protection from harm, so all the lifestyle changes, the exercise changes. We don't want to make the situation worse. On the other side is weight control. Then above that was complementary therapies, integrative therapies, supplements. But right at the top, rebuild. Same as what you're talking about. If you take something away, got to replace it. So if that person and that dog for the last 10 years always walked 3 miles together around the block, and now you say stop, that dog's gonna go, well, why not? Why can't we do that? That's where we spend time together. That's when we were together. And I just think that we need to have that rebuild, like rebuild them physically, rebuild them emotionally, but also rebuild the bond. Because I think it's really hard for the caregiver because it's an arduous journey. It's tough. It's emotionally hard, financially hard, physically hard. And if they don't know why they've got their best mate anymore, if that bond is being disrupted, then potentially some bitterness might set in. Yes, we're singing from the same. I love it. I love
Yes.
it. Tell us about your center. Let's even do like a case. I'm going to make you up a case, and you can just tell me what would happen as soon as they made the first phone call, what you're trying to embody from the first contact point onwards. So let's go for a mediocre classic one. We're going to go for a Rottweiler. He's a little bit overweight. He's pretty sore for his elbows. A bit abducted now. Kind of walks in like this, and he's sore. His mood's
Yeah.
low. And the owner said, look, he doesn't really enjoy his walks anymore. I've just been put on a non-steroidal. That local vet said that you're quite good. So what are you going to do for me?
Okay, so quite challenging. Okay, so let me see. So first of all, and we try to apply, in Portugal, we call the method of apego. So like attachment method. So actually it's a mnemonic to remember that every time you have a patient with pain or potentially with a condition that is potentially painful, we need to anticipate, we need to prevent, we need to empathize with this patient. We need to have knowledge, and also we have to manage this pain the best way we can. So I'm telling you this because before this animal enter my center, we have to anticipate it's coming.
Yeah.
So the first thing I say to my staff is on the call, tell the client that if the dog is big, don't park your car 500 meters away from the clinic. Just stop in front of the clinic, have a call, we go out and we pick up your dog and you put him on the clinic, and then you can park your car with no problem, and you don't have to make your own dog to walk on the street until you find a place and come to the clinic. So the first anticipation is that. So ask, is the dog, can he walk? Does he need help? We can go to the car, bring your dog in, and then you can park with no problem.
But that encompasses loads of stuff, doesn't it? So do they need to bring their own belongings? Do they need to bring their own bed? Will they be happier with their own licky mat and their own food? Do they need an anxiolytic?
All of that. It's very important. Ask them to bring their own food. Normally, we like to give them biscuits in the consultation. But the worst thing you want to cause, it's a diarrhea, and the patient has a painful condition, and then he comes to the vet and he got diarrhea because it just give the wrong biscuits to him. So I say, if it's sensitive, please bring your own. If not, we use normally intestinal food, wet or dry, and then we just split that on the floor and they can eat. So when the patient gets to consultation, he was already supported by the team. And when we reach the reception, someone is taking care of him, giving water, to putting a soft bed, to be assured that the animal is not going to sleep, like this, struggling to stand up. And many times in that moment, the owner learns the first thing of his consultation. I always say, you have to teach something new to the owner.
Yes.
And many times they learn just in the reception, but it is how to hold your dog.
Yeah.
How to help them on the walk, because normally they are like a collar, like that, struggling with the legs, trying to stand up. But you say, no, you can use an harness, you can use a support on this back, and can walk to the consultation.
At that point, I'm just going to do a trigger warning for people, because I'm sure the crowd that are listening are very experienced. They've already kind of got a lot of years under their belt. But if in case anybody is new to these Facebook Lives and they suddenly go, oh my God, my dog pulls, my dog slips. Don't panic, you're not a bad person. But it is a common thing I see in practice, and no owner would ever do it if they kind of sunk down to the dog's level and kind of looked at what was happening. That's a big tip I say to lots of owners, is get down to their ground level and see their world and see their experiences. And as you say, if they're slipping and they're scared and they're getting slightly covered, the anxiety and the pain levels are going to go up massively. And then they're going to get the associations. If they start, well, the pain was worse in that room at that building with that person, I'm not going to go back. So I love the fact that you anticipate and you plan. I think it's amazing.
It's very, very important. And then my consultation is really very big room. I always, the first contact is the owner. You have to reach the owner. Forget the animal. I can say hello to the animal, but my focus is the owner, because I need to win his confidence. I need to reach the truth about what's happening in their lives, what they have done. So we really have to, in a very quick way, to create this bond we call the rapport, in this rapport, this connection with the people, that the person that is bringing an animal. And once again, use the try to empathize the client. You will see very friendly clients, but you will see probably clients that are not so friendly. They will look very like very distant, but especially those distant clients for me are the ones that are really on suffering, because
Yes.
they are not going to tell you, but they are in their minds. Like, my dog is a Rottweiler with 55 kilos. I don't see how I can manage that with my profession. And every night this dog starts barking, the neighbors will start complain. So you can read that
Yeah.
in small amounts of words that the client starts when he starts talking.
Yeah.
So you have to reach, okay, the animal you will treat is what you do best. No problem. I can deal with that. But the most difficult part is to reach what is the problem that brings the client to the consultation. And if you find his pain, the client's pain, what is your pain? My pain is I think I will probably have to euthanize my dog because it doesn't have quality of life. And you say, okay, we can start from that. And then we will treat your dog and help your dog with all these techniques and all this holistic approach.
I love
But
that. And that's, I
holistic,
think, that's the biggest failing in the first opinion sector at the moment. It's like the first awesome step to improvement would be give the vets or the vet nurses enough time to say, how can I help you? What is it that is going to help you? Because that will help the animal. And if you can't get the owner to relax and chill and know that you're helping them, it's a bit sometimes like a bit. Well, I've had a few clients recently where, as you say, they're quite frosty, really frosty,
yeah,
really frosty. And you're like, oh, this is gonna be tough.
yeah,
And then once you start listening in and you really are empathizing to what they're saying to you about how they're experiencing the situation, and you start bringing that into your care plan, you've got a client for life, haven't you? They
yeah,
completely loyal, start
yeah.
doing everything you ask of them.
Mm.
Amazing. So, okay, so you've spent time with the client. Now what happens?
So I conquered the client is the first step. Then I have to conquer the dog.
Yeah.
And normally it's really, and I don't have an explanation, a scientific explanation to that. But that kind of patient that is like looking at you like that, just beneath the owner's legs, and you are like, oh my God, how am I gonna do my assessment if it doesn't let me touch the dog? So
Yeah.
not the owner, but the dog doesn't let me touch him. And when I start talking to the owner and explaining what pain it is and how does it impact his animal's life and how can we achieve that, I don't know if it's the tone of our voice, if it's the
Yeah.
time that we are in consultation, but the animal starts to be like, okay, I can deal that. I can accept that you're going to touch me. Okay, I will let you do that. So in that time, we had already 30 minutes of consultation, Anna.
Yeah.
Okay, so half of the consultation is just talking and preparing everything like that. And then I do my assessment. And with all that, I have already seen my patients. So I know I have an idea about if it's a neurological, orthopedic, or each limb is being more affected. So we all know that if you have a left hind limb lame, so leave it to the end. Okay.
Yes.
Normally we go just directly.
No.
No, leave it to the end. And I don't need to mobilize with, I don't need to do full range of motion to observe reduction of range of motion. You know what I mean? I don't need to be so violent in my evaluation.
Yes.
I don't know if there are any orthopedic surgeon here, but I know some of them, and we left many times. And I say, you always do full range of motion because your patients are sleeping. As an orthopedic surgeon, you give them the sedative and then you just do that.
Yeah.
Don't do that because they will wake up and they will feel very bad after that.
Yeah. I think that's a really good opportunity to debate. I think there won't be debate. I think we're going to both agree on this. So
Yeah.
it's not
Yeah.
like we're going to start fisticuffs online. But I think our role is we treat the illness, not the
Mm,
disease. And I think there's
yeah.
a very different mindset in that my ambition isn't to change the OA. I'm not changing the arthritis. I'm changing the illness that's coming with it, the mood, the discomfort, the lack of
Hmm.
function. And it changes the way that you work. You're not there digging for treasure on day one. You're not pulling them around to try and get your definitive answer, because my plan is to start making them feel more
Yeah.
comfortable. Now, over time, you'll get the answer. It's like peeling an onion. You'll get there. But I think for clients, it can be very difficult. I think they come in as two different clients. You either have clients that want an answer,
Hmm.
or you have clients that kind of go, okay, I'm coming in for a treatment and we'll get somewhere. Do you have the same?
Yes, yes, I really love what you said. You treat illness, not the disease. It's amazing what you said because it
Oh,
really
yes.
makes sense. Yeah, really makes sense. And yeah, I can tell you that sometimes I have patients that we are just having a talk and the animal's too nervous. And I tell them, listen to me, if I try to force a physical examination to him, I will never touch him again.
Yeah.
So I rather to give you a trazodone pill. So
Yeah.
we do a new appointment to 3 or 4 next week if it's not too urgent the condition. And then I prefer to reevaluate your dog when he's less stressed, when you are already know what we're gonna do or what we need to do in your dog. So
Yeah.
not
Okay.
always in the consultation we have all the answers. And I
No,
always
that's really
that's
difficult, isn't it? Sorry to
yeah,
butt in,
yeah, yeah.
because quite often, and I don't know what your pricing structure and your booking system and how long people have had to wait for an appointment, but there's a similarity to the way that I work. Is quite often your first consult will be longer, so it'll be a bit more expensive. So
Mm-hmm.
the expectations are higher.
Mm-hmm.
So it's
Yeah.
very common, guys, for people in practice to say the first consult's going to be an hour, so that's going to be 200 quid, but then the subsequent consults are going to be 30 minutes, then like 75 quid or something like that.
No.
But the pressure, and it kind of sets you up for failing sometimes, because like it's it's long in duration to get the information out the owner, to build up a rapport. I promise you, we're going to come to the good stuff. But this time requirement in that first one is huge, isn't it?
Yes, yes, it is. It's hard to leave a client and not treat it as an animal, not just doing something. It's hard to do that. But
Mm.
if it's a really fearful dog, if it's a really dog, a reactive dog that is reactive or even more reactive because it is in pain, what are you going to do? To hold, to force this dog, to make him struggle with someone will have to do this hard contention to the animal so that you can palpate minimum and try to do something. So where's the best interest to the animal? There's no
Mm.
best interest to them. So it's hard sometimes. I have my appointment agenda completely full in 2 weeks. So next appointment will be in 2 weeks, but we always try to figure out a way of coming back. We have already done amnesis, so next time the consultation will be shorter,
Yeah.
and we try to adapt. It's what we have to do. I always say there are no protocols. I hate
Yeah.
protocols because you don't treat protocol, don't treat a book. This is not what you do. We treat it live. So there's no protocol. People say sometimes students say, well, what are you going to do in this consultation? I say, I have no idea. But you have seen this dog? Yes, but I have no idea. I have to see, I have to touch, I have to learn. So that's the good part of what we do. It's always a new thing to do every time we met our patient again. So
Yeah. I think some people would probably feel a little bit like the prickles on the back of their arms of, you don't have a protocol, you don't know
yes.
what you're doing. I
How can you
think,
do it?
yeah, I think sometimes there's another way to look at it. If you don't have protocols, you are going to have to seriously reassess.
Yeah.
Because if you're doing stuff and you're like, no, I'm going to go on gut instinct, what the dog's telling me, what the illness is, what the presentation. You've got to check in on those and make sure that you're actually making a difference. I think sometimes protocols are great because they've got evidence behind them. They've been assimilated over time. There's a lot of experience, a lot of safety. But a protocol could leave people going, well, I've put him on it and it's going to be fine. Don't need to look at him again. So there's
Yeah.
completely different styles, aren't they?
Yeah, I have my protocol concerning my assessment. I always do that the way I used to do, to not
Yeah.
so that I won't miss. But when I say I don't do protocol, it's like if okay, this dog comes to do laser therapy, but I touched the dog and said, no, we are not going to do laser therapy. We're going to do radio frequency. We're going to do acupuncture wherever. Or today, the animal's going to come to do hydrotherapy as we have in our protocol. But I say, no, this animal's in pain. So today there's no protocol, we're going to do another treatment. So what I mean is to have this plasticity to
Yeah.
adapt according to what the animal really needs. So
I
if you
love
are,
the fact that you said plasticity there when
yes,
you're dealing with neuroplasticity. It's
yes.
so clever.
So imagine if you are a vet. I don't know. In my clinic, it's me. I have a new vet working to me since a very short period of time. So she's just starting now, and I have nurses. And if I put my protocol and say do this, do that, do that, do that, do that, they will do like a checklist.
Mm.
Okay. So they always come and say, here is Bobby. So what is the protocol? And I say, I don't know. Put your hands and give me your feedback. And then I'll
Yeah.
let you know what we should do concerning what we are seeing today. So
Yeah.
you understand that. So it's not like this machine of doing protocols and check, check, check. No,
Yeah.
we really need to see our patients to
No, I
see that.
agree. And when you look at like pain is a very dynamic thing and it changes from second to second, let alone minute to minute and day to day. And reassessing what you're managing. I think there are like recovery protocols. So if you're looking at it from a more structural concept. So I think if you were thinking about like tendon, rehabilitation and stuff,
Mhm.
again, you probably have got more of a protocol
Yeah,
in your head
yeah.
regarding that. But when you're dealing with chronic pain, and you're on a journey where you're not looking to disease modify, you're not changing that. You're looking at what is that dog saying to me about how they feel. They're very
Mhm.
different, aren't they? So if you had a working dog, like a sports dog come in and he has ruptured his Achilles tendon, you're going to have, and he's had surgery, surgical repair, he's just had his screw removed, so he's beginning to just load bear. Then you have protocols because you're
Yes, of
respecting
course.
the tissue.
You have to respect the time of healing. Of course you do.
Yeah,
Yeah. I
yeah,
was
but
thinking more about these painful conditions that you're saying. I was thinking about more this lame dog with osteoarthritis and myofascial pain. That is the kind of patient you do not run a rigid protocol.
yes,
It's what I mean with that. A post-surgical, you know what to expect. Okay,
yeah,
so in that case, it's good to have a protocol. If the animal goes different from what you were expecting, now you know that something's wrong.
yeah, yeah,
So it's
yeah.
good to do that.
No, I totally agree. Just in case anybody was like a physiotherapy lecturer or there was somebody
Yeah.
in the crowd going, "What? How dare
What
you
was
say
this
that?"
crazy?
They're kind of rebelling. Okay, so our lovely Rottweiler, he's been in the room for half an hour. You've been questioning his owner. You've picked up that she's still a tennis ball thrower. You've picked up that her flat's got marble floors. There's an elevator that's often broken. No, a lift that's often broken. So he's doing a lot of steps. Um, and you've found a few things that you feel that are going to really change that dog's lifestyle. What do you do next? Like, you do a lot of observations, palpation. Do you
Hmm.
treat on the first day? Do you plan to do anything? Do they
Yeah.
stay for the day? What happens?
No, normally when it's a we divide consultations in first consultation. That could be first opinion, second opinion, or referral case, but it's
Yeah.
always an assessment, a first assessment. So that consultation normally takes 1 hour, 1 hour and 30, because it's the time to do all the assessment, all the analysis, all the assessments, all the what to do next, home recommendations and clinic recommendations, and then try to do at least one treatment. Because if possible, I would like that this animal could at least benefit from something, some of our techniques, so that it could take something good at home. So many of them come from far away. So you don't ask a client to drive about 1 hour and then go away home without doing anything to its patient. Okay, so only very particular cases that I might not be able to treat the dog, and will be better to come next day. But normally we always try to do, I don't like to do acupuncture as a first treatment. Okay, if acupuncture is indicated, I don't like to do as a, I would say you don't do the difficult stuffs in your first meeting. You do the good ones. When I say good ones, the one that will make him not feeling the sense of the needle, because some dogs are really sensitive to that. So normally we try with laser therapy. It's quite well if he has trigger points. We do massage also. We use this pressotherapy massage that really helps on very big group of muscles, and help releasing the muscle tension and trigger points. And normally we explain that we will probably reduce relief pain for a short period of time, but we explain what to expect from now. And then we ask client to call us in 1 or 2 days just to tell me how it is. And if you don't want to call, please write in a paper something so that you won't forget what you saw in your dog.
Yes, that's a good one. I like that. I like the idea of saying, in 2 or 3 days, please write down what you've noticed. Totally. Like, that's the reason that I like the client specific outcome measures rather than the questionnaires, is because you spent that time talking to the client and they've told you their observations that something's not quite right. And then it's about choosing the right observations, harnessing them into being the monitoring. So you can pick out things and go, I know that will change. I know that will improve. I know that will. So then you can reinvent them as your monitoring tool. And I used to, after the next session, like before the next session, I'd always sit down first and go, so what's changed? But what you're saying is do it at the 3 days. They write it down. Amazing. Love it.
Yeah, and the 3 days is really for a reason, because you will see impact immediately, or even next day you will see some impact of what you've done. And the next is really important to explain the expectations. Okay, so explain, you don't want to say what the client has to see, so you don't want to make this bias in what is going to report to you. Okay, so you don't say, oh, you will probably do this or do that. I don't do that. But I normally say that don't be expecting just to see a modification on this walk. So pay attention to behavior, pay attention to if the dog is eating better or not. Pay attention to reactivity to other animals or people. So what I try to do is to evaluate pain relief in several dimensions, not just the motor components, but also the emotional components, or even the social components of pain. So if the owner, many times they say, okay, he's still lame. Okay, he's osteoarthritis, grade 4, I don't know. So you will be lame to the rest of his life. But for the very first time, he went to the cess ball with toys, and he just picked up one and came to me and asking for playing. So that's amazing when the dog does that. And you said, how long is not doing that? Oh, several years ago. I can't remember last time he picked up this toy. So that's what we have to look for, the behavior changes. Yeah.
And I think, again, if there's any vets listening, another thing we've talked about, a key part of any chronic pain consult is asking the caregiver, how are you? How do you feel? What's worrying you? But another really big thing to speak to the caregiver about is their expectation of change. And I'm the same as you. I maybe bias them a bit. Maybe I'm a bit too giving because I'll say to them, please don't expect there to be incredible physical changes. You're not going to see their gait suddenly change, but I'm looking at mood. Like English, the word mood in English is quite encompassing of how
Yeah.
they feel about the world around them. What's their mood?
Yeah.
And I find that's really useful because they'll come back and they'll be like, yeah, mood's a bit better. Whereas quite often I'll see people that have had a chronic pain adjunct, so they've had another medication added and not seen them say 2 or 4 weeks. And I'm doing a recheck from a colleague's case, and they'll be like, wow, no improvement. Don't know what we're doing with this drug. And you're like, okay, what's their mood like? Oh, he's all right,
Yeah.
actually. Yeah, he's quite good. Yeah, that's what you're
Yeah.
supposed to be expecting.
Yeah. That's exactly that. And
Yeah,
it is what you, it's the definition of pain. How does your pain makes you feel like?
yeah,
So are you feeling miserable or are you feeling okay? I can deal with that. So we want patients that say, okay, I can deal with that. I can
yeah.
cope with my life and do my normal steps the best I can.
I love it.
Uh,
So tell me what the video was for the social time. Because you've just told me that they kind of come in as an outpatient and they come in and the caregiver stays with them and it's a treatment and then they go home. The videos I saw, they were
yeah.
with you for the day.
Yeah. So we have two different kinds of patients. So we have these ambulatory patients. When I say ambulatory, it's like the clinical, they come for an appointment and then they go home and then they come back in 1 or 2 weeks or next day, whatever. And then we have the internal patients. So those, they stay with us for entire week. So yes, normally they stay with us because we are not a very big country, but it's hard for people to go to the appointment 2 or 3 times a week.
Yeah,
And many clients are really live far away from our center.
yeah,
And also to manage a paraplegic dog, for many people it's completely scary. They don't know what to do, so they prefer to let them at our center during Monday to Friday, and then they pick them on Friday and they have their animals during the weekend when they are not working, so they can
yeah,
pay all the attention to the animals. So those animals that you saw in the video actually are those that normally stay with us for an intensive rehabilitation program. So as you can see, they miss their home, they miss their owners, they miss their beds, their environment. So normally, when they come to us, mainly post-surgical, they just came from the hospitals directly to our clinic. So they are completely, I used to say the word, they are completely broken. When I say broken, mental broken,
yeah,
they, like if they lose all, I don't know, probably, of course, related to very near the surgical procedure. So they had sedatives and all these painful conditions and all that. So it looks like they lose all their hope when they
yeah,
reach the center. And then what we do is of course, we do all the medical support and the nursery support. We do all that and physio support, but we try to make them believe that they will start walking again. So that's what we do. So if you are a dog, tetraplegic or paraplegic, ambulatory, wherever, and then you start the lunchtime and everybody goes to the open space and start eating, time to eat, time to look for a treat. Many of those dogs, they are willing to do that. So they want to do that just because they
yeah,
are seeing. So once I saw a study that telling that sports, if you are a sports, if you do I don't know if you practice any kind of sport.
yeah.
Okay, so imagine football.
Yeah,
Okay,
yeah, yeah, yeah. If you're like a team player or if like I
yeah,
like kite surfing and paddleboarding. So if I saw
yeah,
it, I'd be like, I want to do that.
yes, but it's important to see that. So
Yeah,
as a player, you don't just do your daily routine practice as a player, but you also see games.
Yeah.
because when you see it, you are integrating the mechanical procedure, what you need to do when you are just in the field in order to do your practice.
Yeah.
So I don't have this foundation, but I think that if you have your own dog that is looking for other dogs, they are trying to move, they're trying to stand up, and they are actually doing, you are willing to do that too. You want to
Yeah.
do that, and you learn how to do it again just by visualizing other dogs doing that. So
Yeah.
instead of staying inside the cage for an entire day, so we give them space. We in our center animals, we have an internation area, but they normally are in the outside in the open zone. So they are laid down in their beds. They have their own spaces, but they can see each other unless they are reactive. Okay, if
Yeah.
they are
Yeah.
reactive, we have to put them a little bit apart from other dogs.
And how many can you have at any time?
Uh, 10 in a routine daily basis, 10 animals, it's a lot for us. So 10 is too much. It's the maximum that we can have an
Yeah.
intensive care. And then we have all the consultations that come to the practice.
My
We
God, that's busy for one vet.
Yes, now we have two vets. Okay, but yes,
Yeah.
the external consultations are depending mainly on me, okay,
Yeah.
at this time. So what I do is I do my assessment and then I supervise the team to say, okay, just do this or do that. We should do this protocol to this animal.
Yeah.
But those that are in intensive treatment, they had their own assessment. So every week I do their own assessment. So in order to define if they are going well or if we need to change something uh,
Yeah.
in any kind of treatments that we're doing. But it is a lot at this time. Actually, it's a lot. Yeah, yeah,
That's tough. I've
yeah.
just noticed the time. So what I'm going to do is I'm going to say to people, if you've got questions, please do butt in. Katia's here. I'm going to try and keep her for another, say, 15 minutes. Is that all right, Katia?
Yeah, perfect.
And if people don't kind of bounce in with questions, what I might do, bear in mind that me and her have had a brilliant chin wag, and I'm hoping we're inspiring people. I'm hoping they're inspiring Evie, because me and Evie want to set up her own place. We've been
Mhm.
wanting to do it for years now.
Oh,
But it's just always been it's been tough. It's been tough finding the right place, the right time, and having also the confidence to do it. But our daydream was to have the ability for the animals to come and stay with us for periods of time, like you're talking about, where you really can make quite big headway. But we also wanted it to be a retreat for the owners. So we wanted to have like a campsite where there's some really nice bungalows, so that there was a really nice area, because we see people that are so stressed, so,
yeah.
so stressed. And we just feel that there would be such a bonus at not only reducing their anxiety levels, because that all be reverberate between the pet and them, pet and them, pet and them. So yeah, we're looking for investors, angel investors. But right, we're going to jump straight to 10 top tips whilst people are coming up with any questions that they may have, because I'm going to make you do kind of short, sharp answers, 10 pieces of advice that you'd like the lovely Cam and Member Zone people to know. I can jump in, but I do this all the time, so I'd rather you kind of were like, I got this. And then if people have got questions, pose them now and we'll tag them to the end. So go for it. What's your 10 top tips? Start with 10.
So the 10 is not the highest one, right?
No, it could
But
be any, no hierarchical order.
okay, so it could be anyone. So for osteoarthritis or for any kind of conditions?
Let's try and stick to arthritis, merging
Okay,
into chronic pain states.
okay. So my tip is buy a pair of shoes for your dog. And when I say a pair of shoes, don't need, sometimes I use those balloons, party balloons for small dogs. I
Yep,
cut the part that we used to insufflate the balloon, and you
yep.
have a very fancy shoe for a poodle or a Yorkshire, and you don't need to expend too much money.
I love that. So let's just expand upon that. Here in the UK, I think that we can push people to get rugs easier than we would do if we're in a hot country like Portugal. Not a chance in somewhere like Morocco with a hot, dry environment where people just have stone floors. And I think people are less likely to put rugs down, but because we've got a different climate, I think people. So do you find that you're always trying to get people to put something on their dog's feet to try and give the traction?
If I always, well, I always have to, depending of the environment.
Yeah.
Okay. So if they live in the apartment, normally it's really, really, really easy for them to be all the time trying to stand up.
Yes.
So I recommend that. But I always recommend under supervision
Yeah.
because it's really easy to do to limit the circulation of the toes so they become
Yeah.
swollen. So always with careful. But it also, of course, if you cannot put anything in animals too, use a carpet. So
Yeah.
try to use a kind of
It's
floors.
really interesting because I was at, I'm just going to do a little bit of a shower. I was at a event last night and I was hanging out with some vet physios and we were talking over wine about foot stuff for dogs. And this physio, amazing lady, Colleen, she was really excited because she'd used a kind of like an epoxy gel that sets and she'd molded it around the toes. And then she was putting some rubber etchings into it. And those that are kind of like epoxy resin over the tip of the nail would stay in place for quite a while. And it was ridiculously cheap. This is why
And it
she was
works?
doing it. It was
And it
really
works?
cheap and it
Wow.
worked. Because I was saying there's lots of things like this Dr. Busby's, and they're great. They're the rubber rings, but they're very expensive. And I think, they're like 50 quid a pack. So then you've got the gel on claws, which I'm just about to practice on Luna because I'm at my parents' house and there's slippery floors and her back legs. And then you have the booties, the paws. They all add up. And when these things are falling off, like if Luna goes out and all of the glue on gel-ons slip off, I'm like, whoa, that's £15 gone.
Yes. Yes.
So I love the fact that you're just using balloons.
Yeah, and in Portugal we are not a very rich country, We need to be creative in order to give solutions to our clients. So
Yeah.
it's like €1 and you buy 20 balloons in a store. So
Yes, I like
yeah.
that. I'll introduce you to Colleen so she can share her epoxy concept with you.
Yeah, I would love to know it.
Cool. Number 9.
Okay, we have a question of
Ooh, do we?
yeah.
Go for it.
I think it's
Evie's co-hosting. She might be able to help us out. Okay, can I please ask a question? We are making great progress with managing away. My dog Heidi is been on NSAIDs. Oh goodness, it's gone. Where is it? Can't breathe. 50 milligrams a day for. Oh, can you read it? It keeps jumping for me.
your son doesn't look very good, Hannah.
My sound?
Yeah.
Oh, sorry. Are you happy to read the question? Because it keeps
Oh,
slipping away from me.
okay. Yeah, it's okay. Okay.
Do you
So
want me
my
to read the question?
Go, Evie. Go, Evie.
Go, Evie. No, Evie.
Come on, Evie.
I'm here.
You do it.
Right, let me find it. No, it's gone because it chucked me out and now I'm back again.
So you are an inviter, Eve, right?
Yes, it's just been funny. I can see it, but it keeps sliding away. Here we go. It's been on Carpri 50 milligrams a day for 3 months now, amongst lots of other therapies and changes. I know that humans need to be careful with non-steroidals. Heidi has blood tests. How long can a dog safely take these non-steroidals? Should we try and reduce them after a few months and see how we go? Thank you. Great question.
Yeah, actually, it's that kind of 1 million question, right? The one that we always when is the right moment to stop a specific drug. So Patrick, that's really a concern that we always have to have in mind when we have a dog with such a long period. Many of the drugs we have on market, they did not do studies for very long periods. Normally it's between 3 months, 6 months, depending on the kind of drug that we are talking about. But what we know is when we talk about osteoarthritis, we know this is a low level inflammatory condition, although there is an inflammation associated. So when we are concerned about drugs or specific medicine that might bring some secondary effects, what we try to do is to manage the condition the best way we can with the most safety conditions like a physiotherapy, nutraceuticals, environmental changes. Well, probably you know that because you have a dog with osteoarthritis. And then we try to reduce or to maintain a specific drug according to the need. So maybe, I don't know, we don't want to talk specifically about a particular case, right, Hannah? It's not our intent to talk
No,
about.
I think it's a brilliant concept to be talking about, and I think me and you are kind of like aligned on it in that when I say this to owners, they immediately go, I get it. So I often say the worst side effect is leaving them in pain, like, by saying, hey, I'm really scared of using that medication because this might happen.
Mm-hmm.
I'm going to come off of it, but then actually an unmanaged pain state, the consequences, the repercussions of unmanaged pain are huge, huge.
Much worse.
And that,
Yeah.
yeah, exactly. And that pain becomes harder to control, and it has an impact on your cardiovascular system. It has an impact on your tissue healing, your immune system. So we need to always be cognizant of how bad being in pain is. It's a disease in itself. And what we kind of do is we try and get the best of both worlds. We try and get the lowest pain state with the minimal amount of pharmaceutical or interventional interventions. But we don't fear them at the risk of leaving the animal in pain. It's a real seesaw, isn't it? And the only
Balancing.
way you can do that is by regularly reassessing and being observant.
Yeah, I agree with you. And also do this blood sampling every time, just to keep the animal an eye. I agree absolutely on you. So, sometimes people want to, when they start physiotherapy, they want to reduce everything. They want to take all the drugs off. And I said, don't do that.
Yeah.
Because it's a complementary treatment. It's always multimodal therapeutics. So that's what we do. We manage the secondary effects, or we try to reduce them according to specific drugs that we might be used.
Yeah.
But many of them that are authorized for small animals like dogs, okay, are pretty safe. And the more selective they are, the safer they are. So
yeah, and I think so. Just to put people's mind at rest, they have tested certain non-steroidals for over a year, like every day. So Previcox, for example, there's a 360-day study, and when you look at the side effect profile of being on them long term, was it any different to placebo? No, actually not. So there's this real belief that being on non-steroidals leads to degenerative over time. So there's that kind of belief that, oh, I'm putting this drug in, it must be toxic, and over time the toxicity is going to affect those organs. It doesn't work like that.
yeah.
So duration isn't really the player. It's about the dog. They either have a sensitivity, and you generally find that out quite promptly. You find that out in the first few weeks, or they have a comorbidity. And that's another thing that people don't realize is, unfortunately, when you're given one disease, it doesn't mean that you're immune to everything else. If anything, you become more susceptible. It's an age-related disease, age-associated disease. Other diseases come into play at that same time. So it could be that your dog's quite happy on a non-steroidal, but then they pick up something in the park, or they get a virus, or something else is happening.
Yeah, absolutely agree
But
with
then
you.
it still bounces back. to observation, 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 observation. And you'll be really impressed with this, Katia. I was talking to an immense rheumatologist called Helen Cohen yesterday. She's coming on cam soon. She's amazing, like scary, clever. And we were talking about acute flares and how the massive bonus of being human and being able to verbalize your pain is that you can really tighten a pain relief protocol because A, you're giving it to yourself.
Yeah.
B, you can verbalize exactly how you feel, where it feels, what it feels like, how long it lasts, what the frequency. So in humans, the non-steroidals that we use are very tailored around flares. So when a person experiences an increase in their pain state, they can up their meds. And when that pain state comes back to baseline, they can down their meds.
Mm-hmm.
And we can do that in animals, but it takes amazing observational skills. It takes time. It takes daily check-ins. And there isn't going to ever be a protocol or data to fit that. So you're not going to find that Zoetis. They're not going to go, I tell you what we're going to do. The next drug trial that we're going to do, get this. We're going to tell the owners to give it when they feel like it.
Oh,
We're
God.
we're going to compare that to a group of dogs that don't have anything. We're going to see what happens. We're going to throw 10 million at it. It's not happening, guys. So, but theoretically, we should be managing the acute flares rather than blanket treat. But because we have that boundary, we assume and we treat on a regular basis. Am I fair to say that, or do you disagree?
Yeah, I agree what you're saying. What concerns concerning to the non-steroidal steroids, I agree with you. If you use everything you have, how do you control flares that you're already doing everything? So we need to have a backup drug so that you can rescue the animal when it's in need. But that's the million question, dollar question is when can you really reduce the doses? When are you comfortable trying to do that? Are you comfortable to maintain the dog with the minimum doses, or after 1 month just stop the treatment? Or probably you are not able to do that because, as you said, the patient, the animal will not be able to tell you, and many owners are not able to see that.
No, I agree.
So it's, for me, for instance, many times I recommend paracetamol at home as a SOS drug, and normally the owner say, when do I do it? And I say, when you feel there's a need. But then I think about, what about this owner being able to recognize really pain? So we need to teach this owner what could be the signs of this pain, like increase frequency of respiratory frequency, or the animal licking the limbs, or not sleeping well, or not eating so well. So we need also to teach those owners how to identify that. Yeah.
I totally agree. Okay, another question. I wonder about the efficacy of omega-3 when you can't really reach the therapeutic dose, which is quite high. For my 6-kilo dog, I've been told the therapeutic dose is 100, it'll be 100 milligrams per kilo, 100 milligrams per kilo, which means right, so yeah, so actually I've been reading about this today, so it's all very dismal. We've got a number of studies in the vet sector that are good quality studies that have shown that by supplementing with the omega-3s, you do have an impact on their non-steroidal requirement. So these dogs were already on a non-steroidal, and by them being on a therapeutic diet that was heavily supplemented with omega-3s, their requirement for their non-steroidal was titrated down effectively. Their pain state didn't worsen. And the figures that they were using were quite high. So that's where this 100 milligram per kilogram comes from. However, some people say 70 and some people say 300. There's a very mixed bag. And then when you look at the human literature, it's about the ratio between the omega-6 and the omega-3 rather than the actual quantity. And then if you're trying to hit a ratio, then it depends on what else they're eating. So everything else, yeah, I know. So then you get into this very, very unsettled waters of, well, how do I do this? And whether people like me or not for saying this, that's why I use therapeutic diets, because I know that that is going to have the ratio in it. And its price point is predictable. You've got your food, the supplements in there. It often has a weight controlling component to it. I just know it ties up a lot of loose ends, but a lot of people won't like that because it's a kibble or a tin-based diet. What do you do? How do you manage this little whirlpool?
Yeah, it's not it's not easy because we don't have this we are not used to do blood measurements of vitamins, or in this case omega-3 ratio, omega-6 on the animal's blood. So we are always like blinded, you know.
Yes.
It's so hard, and depending on the kind of food this animal's eating. So some of them are eating commercial solutions, which theoretically should be a balanced food. I say like that because many of them are completely full of omega-6
Yeah.
oils, which is awful for their health.
Yeah.
So I don't have an answer to that, actually, Hannah. I'm so sorry because it's for me, it's really hard because I don't know how is the balance in this animal in particular. So what we do normally is to the supplements that are allowed for veterinary use, we want to believe that they have the optimal combination of omega-3 ratio. So depending on the recommendation, we know that the recommendation that is like 2 pills a day or 3 pills a day, we know this is just a orientation. It depends of what you said. What does this animal eat every time? What is the
I'm
kind
going
of
to say
food
something
doing?
outrageous now. So I've been spent the last few days and writing a presentation for the veterinary physiotherapists here in the UK about supplements. And I was like, God, I'm finding this really tough because I don't like literature review. I don't like critically analyze. I'm not trained in it. It's very hard work for me. Also, you read one paper and you go, oh, yay. And then you read another paper, you go, oh, no.
Mm-hmm.
And they're very contradictory in their findings. And then you can go to the systematic reviews and people can complain about them. So I kind of started thinking about, this concept behind supplements, which I think we need to deal with, is that I think people put a lot of weight on them making a difference, and they bloody probably don't. If we're
Yeah.
really, really honest, do they really, really make a difference? Because I would say that the evidence really is in favor of them not. And so when I was like a few years ago saying to myself, do I want to invest a lot of money in Holly's, care plan on supplements? And I was like, no, I'm not going to. I'm going to take that money and I'm going to be putting it into hydrotherapy, physiotherapy, buying a dog trolley, having a new coat, putting rugs down. And all of those things made a lot more sense to me because I think no one has a money tree. And I think when you're looking at a certain amount of resources, where is the best investment? And for me, I'm able to sleep at night saying my best investment is in lifestyle and the, rehabilitative kind of interventions. People can disagree with me. What do you think?
Yeah, I agree with you. I think that, Hannah, if you invest a lot of money in specific oils, but then, for instance, you don't do your best selecting your dog's food, so you are just missing everything. You are just messing everything.
Yeah.
So, and also, we know that omega-3, yes, they will perform. We know that they are in the guidelines for supplemental, that in between all the supplements available, the one that have some kind of evidence that really will help on this reduction of inflammation. I agree with you. It's some of them are really expensive for many patients, and you might give that to your animal, but if you do not change the lifestyle, if you don't change, so we know this is a multimodal therapeutical. So we know that we are not going to use just that supplement, and willing to have a life change in our patients, in our dogs. So it's a kind of balance, Hannah. I have clients that they buy by themselves. They have lots of online shops where they buy supplements, and I'll do that. The only thing that I ask them to do is see what you're giving to your dog, see the source of the oils that you are giving to your dogs, and then try to figure out the kind of nutrition that you are able to support to provide to your animal. So it doesn't matter that you're expending a lot of money in oils if you are not giving them good food with good
No,
sources.
I agree. Sorry, that was Elsie. Elsie's being silly.
Yeah.
She's getting bored.
Oh,
I tell you what, because we haven't got any more questions, I'm going to say yes, the supplements I think is always going to be a contentious topic. It's always going to be difficult.
yeah.
Their regulation is always going to make there's so many unknowns. So because they're unregulated, that doesn't mean that there's safety data. That doesn't mean there's efficacy data. Many of the products on the shelf, they literally, the best you're going to get, guys, is good manufacturing process, which means what we say is in the packet is in the packet. That's and we've got a batch number and we've got a lot number. That's what good manufacturing purposes mean.
Yeah.
Yeah, it doesn't mean that they've done safety data, and it doesn't mean they've done anything about efficacy. And I've had so many companies contact me because they want us to springboard them into, sales. And I'll say, can I have your clinical data? Where's your clinical trials? And they actually send me papers from like the 1970s that were done on rats, mice, and humans. And I'm like, that's not even in this century that you're referring to. So they've plucked papers out of the sky, old data. They've gone, oh, in that one, they say 5 milligrams of boswellia. Yeah, let's use it. That's what we're going to do. We're going to chuck it in that pill. And I just think that there needs to be a lot more open talk about what is happening, because I think there's a real belief, and I think the human belief about them having this core role in OA management is so strong. I think that people need to actually go, do they? Do they? And if on a diagram somebody said, oh, supplements, I'd take that out and I'd put a rug in. I'd be like, piss off. I'm sorry, rugs every time. But I'm not saying that you shouldn't use them. I'm just saying, question. Okay, I'm going to be facetious. I'm just going to be facetious. Isn't this normal for people to say, oh, so the supplements, it's working really, really well. And then they have an upset tummy. You say, oh, could it be the supplement? Oh, no, it can't be the supplement. You're like, well, if the supplement's active, if the supplement is doing something active to the body, then yes, it could cause an adverse event. So supplements get put in this little blanket, protective blanket. Oh, it's never them. This is another one I thought of the other day. When owners have polypharmacies, there are multiple drugs, they're really worried, so worried. But when you go to a supplement, you're like, oh my God, Mabel, it's got 5 different supplements in this one pill. And you're like, that's polypharmacy.
Looks like inoffensive, but it's not like that. So yeah.
I feel a bit bad. I feel like I'm picking on the supplement companies, but I do think that we just need to put them on the same kind of like stage as other interventions. We need to critique them. And we need to critique our own beliefs about them. And it's all done with me in good favor of, I want you guys to spend your money appropriately. And I don't want your dog to be having pills forced down it that are not doing sod all. Yeah, can you imagine that? My neck hurts, my jaw hurts, and every evening she enforces these 4 massive gobstoppers that don't do anything.
Yeah. And imagine the relationship with the owner. If I had to give that every day to my dog, it will just hate me at the end of the. Many dogs, we have really problems with that, with this compliance. The owners simply not able to do that.
I agree.
For them. Yeah.
I agree. One of the slides in my in my presentation, you're gonna love it. There's a picture of a dog, because I've taken inspiration from you. Big picture of a dog. And the first sentence says, I'm really happy giving them. So this is the owner. I'm really happy giving them because they may work. And then underneath the dog says, I'm not, because my food tastes like shit now.
Yeah. Once again, empathize with your dog.
Totally great. Yeah. Okay, so I'm concerned that everybody's kind of like, we've already hit coming up to 9:30. You've been talking for an hour and a half.
No problem. We still have a question from Leslie. I don't know if you want to answer,
Yeah.
Leslie. And then
Sorry, she wanted it Luna in. Let me find it for you.
Leslie, right?
Oh, here we go. My 9-year-old husky was 49.85 kilos. He's on Librela, a non-steroidal, and a synthetic opioid. I got his weight down to 41.75. That's 21 tins of beans. I love that analogy. It's amazing. I have continued with his meds, but looking at him today running around like a puppy in the private hire secure off-lead field with his 33-kilo husky female housemate, I believe it's been a whole multimodal approach, including rugs, supplements, laser therapy, leg supports for his carpal hyperextension, which has helped him. The biggest help has been the weight loss. 100%. But you definitely would be somebody I'd be talking about trying to phase down some of those interventions now. If you're seeing such a change in demeanor and enthusiasm and capability, I would have a chat with your vet and say, right, we're getting somewhere now. What can we shift? And it will be a personal opinion what the vet chooses to reduce. I know what I would reduce first.
Yeah.
We all have our own opinions, but that's great. We only got to number 10 in the 10 top tips. It means that you're going to have to come back and do 9, 8, 7, 6, 5, 4, 3, 2, 1.
Give me a tip. Give me a tip, Hannah, just to finish.
Oh, I've got to give you a tip.
Yes, I want to know.
Okay, so my tip, I'm very, very much about communication. And I feel that the vet sector is really, really beginning to embrace chronic pain. It's still slow. It's still very slow. My tip to any client, any owner, is to ask your practice, what can you do for me? Say, what services? Do you do weight clinics? Do you do nurse clinics? Do you do chronic pain consults? Do you work with a physio? Do you have connections to hydro? Have you got a massage therapist? What can you do for me? Because on CAM, we have so many people arrive saying that my vet wasn't interested. But when you say, did you ask? And they just didn't offer. So my big tip is please, because the knock on is if practices keep being asked, what can you do for me? They will start creating those services.
Yeah.
So that would be a tip.
Creating the need.
Creating a need. And then my dog related tip, scatter feeding. Bloody love it. When you said you sprinkled food on the floor, I was like, love this lady. I just love that.
They look like chicken like that. Chuk, 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 chuk. So amazing. We call lunchtime. It's really funny.
I love it. I love it. And like, seriously, I'm going to say something quite bold. I think you were the most exciting person that I got to watch in 2023.
Oh, God.
You really, really blew my mind. And I really hope that pain streams at these big conferences around the world start embracing this greater understanding than complex drug calculations, So high five you.
Okay, thank you, Hannah. Amazing what you're
Either
saying.
you.
Yeah.
Perfect. Well, what we'll do is I'm going to get Evie to see if we can get you back in 2025. I would actually really like to invite you to speak at the Chronic Pain Symposium, which we're hosting in April. So we'll get Evie on that because I just think you've got so much to share. And I think also you're going to empower people to do it their way. I think it's quite oppressive that you've got to use a goniometer, you've got to use, Gulick tape, you have to have a pressure stance analysis, you need to have a gait analysis. I don't think you do. I think the general population out there just want their dog's illness better.
Yeah, absolutely agree. Let's make it simple and let's make it accessible to everyone. I think that's the idea, to all the vets, all the student vets, nurses, everyone. Teach the people, give them the power. If people know Once I met a trainer, and she used to say, I don't know, all the time I see dogs in pain, and I tell my clients to talk about that pain to their vets, and the vets say there's no pain. So what can I do? And I say, tell them to change vet. I'm so sorry, but tell them to change the vet, because if the vet is not seeing the pain, bring them to me or bring it to other vet that works with pain. And many dogs with problems on behavior, they are really dogs misunderstood. They are really, people are missing their pain, their suffering. And I really appreciate work that you're doing. You all doing on camera an amazing work, creating all this awareness. I don't have the total picture about your work, because I know it's a very short, last 2 years maybe. And I always use that video that you did, absolutely brilliant. Everybody cries in that lecture. When I put this video, nobody should suffer in silence. And it's absolutely impacting, life-changing for many vets. If you use this video in lectures for professionals, the first-line professionals, you will wake up on them something. That's
what I hoped. That's my Holly forevermore. Never forgotten. Just yes. Oh, it's been
amazing.
a great one tonight. Thank you so much for your
Thank
time.
you very much. Thank you.
Thank you all you guys for listening. We will be back again next month. Evie is on it with these amazing guests and our tea and chats. So we will see you guys again soon. Take care.
Bye.